Dr. Bunio, we're back.
It's good to see you, Chris.
Man, it's been, 2 weeks now?
It has been 2 weeks.
It's been a lot going on.
Mm-hmm.
So what I'm most excited about is what you're wearing on your face today.
Yeah.
Let's talk about that.
Well, yeah, I'm excited too. We are now at COVID risk level yellow.
Uh-huh.
For those of our dedicated listeners.
Our dedicated of listeners.
Yeah. They may remember we were at risk level red.
Right.
2 weeks ago. We got down to orange last week, and now we're down to yellow. So I want to just really thank the community for, following the 3 W's, wearing their masks, social distancing, and avoiding these large gatherings. It is working.
Right.
So again, just really appreciate
kudos to the community for that. Well, I noticed you brought some folks along with you today. Do you want to introduce them and kind of get this party started?
Yeah. I know that, when I saw the list of questions, I thought I better bring some backup.
Right.
And so,
I like it. I like your style. That's what I do.
That's right. And so I know we're going to be talking about school.
Right.
And so I've got a couple of guests here today.
All right.
I've got Kayla Gresh, who is a licensed clinical social worker. She works in the integrated classroom.
Oh, good.
She's part of the Anna Lanischke Child and Family Therapy.
Good. Welcome to the show, Kayla.
Yeah. Thank you. It's nice to be here.
All right. Who else we got?
And we also have Dr. Linda Givens, who's one of our fabulous pediatricians up at Cherokee Indian Hospital. And she's going to help answer some of these questions that I know that we need to get to. I think there's a lot of questions about kids and getting back to school and how we're going to navigate that.
Dr. G, medicine woman, as we mentioned before the show.
That's right.
I like that.
That may catch on.
I think that's catchy. She's going to be just as popular as you, Dr. Bunio.
Oh.
That shouldn't be hard.
Yeah. You're not going to be able to eat lunch at the Mexican restaurant alone any longer. You're going to have to carry security with you. So tell me a little bit, Dr. G, we'll start with you, about kind of your background. What got you into this field?
So I am a native resident of Western North Carolina. I grew up in Asheville, and I always can never remember wanting to do anything but be a doctor. And I went to UNC Chapel Hill School of Medicine, and I did my residency in Charlotte, North Carolina.
Awesome. And
I really enjoy being a pediatrician.
What do you find most rewarding about being a pediatrician here?
After practicing 30 years and you think you've seen a lot,
yeah,
I've seen a lot more.
Okay.
And I still feel like I'm growing here as a pediatrician, but more than anything, the patients and the parents.
Good.
They've been really special to me. So I've made a lot of friends here.
Good. Well, thank you for your dedicated work to our community. Kayla, tell us a little bit about yourself. What got you into your field?
Sure. It was a little bit of a long journey for me. I've worked a lot in more bigger realms. Working on international politics is kind of where I started. But what I learned over the years is that the way to change the world is really to help people be the best versions of themselves.
Good.
And that's really what led me down the road to therapy and helping people overcome trauma and so that they can go out and do good work as well.
Excellent. And are you excited about the new Anna Lanischke build-out, the new building?
Yes. I haven't gotten a chance to go up there yet, but I am so excited.
It's beautiful. They did the ribbon cutting last week, and we got to do a little tour. It was exciting.
Yes. I can't wait. I think it's a great addition to our community.
Good. Well, thank you again for your dedicated work to our community. Dr. Bunio, are you ready to get into this? We got a lot of questions.
Let's get going.
Let's do it. So we're going to be bouncing back between folks. If you have anything to kind of add to the conversation on each of the questions, please add to that. I know that we don't know all of it, so we're going to do our best to answer these questions that the public have. I've got a 4-year-old, and I want to know how to explain to this 4-year-old who's curious about why everyone's wearing a mask and why he has to wear one. I feel like he's too young to really understand what COVID is. How do I talk to this child about that?
So one of the things that I tell parents, the best thing to do is to be honest with your child.
Okay.
And so first of all, parents need to educate themselves about what COVID is,
right,
so that they can sit down and talk to their kids about it. And the best thing to do is to find a time when you're not pushed, you're not rushed. Dinner time's a good time, or get out, go to the park, sit on a park bench, take a walk. And we don't want to create fear in our kids. We want them to be educated correctly about coronavirus. So one way you can start out is just talking about germs. You
Right.
know, they're good germs and they're not so good germs. And so that can lead into about why we have to wear a mask, because the mask keeps us from getting germs from other people. Then we can talk about washing our hands, why we wash our hands. And then you can do things about, teaching about social distancing. You
Right.
know, take a tape measure out 6 feet, show them what 6 feet is. You know, if you take them in the grocery store, let them know, well, this grocery cart keeps us 6 feet away.
That's a good point.
And so the thing that we need to do with our kids is to teach them. We don't want to instill fear in them, but we want them to know. And I think by doing that, that child will understand COVID a lot better.
Right.
And then if all else fails with that parent, Sesame Street has a great video that they've made that you can pull up on YouTube and that talks about COVID-19. But the thing is, just be honest,
Right.
about it.
Good. So Sesame Street's done a video that explains a lot of this
Yeah.
for the younger children.
It's a great video, and it's about 45 minutes long, and
That's
it goes over everything about COVID-19.
Wow, that's incredible. I didn't know about that. So it's a good resource for the public
Mm-hmm.
to use. Okay. We'll move on here. These are going to fall off on me, Dr. Bunio.
I gotcha.
We've got so many questions today.
I know.
My daughter does not understand why she can't hang with her friends as long as they stay 6 feet away and don't touch each other, and I'm having the worst time really trying to explain this as a measure to keep her safe. As well as her father and I, what do I do?
Yeah, that's really hard. I think one of the hardest parts of this pandemic for all of us is having to stay away and
Yeah.
socially distance from our friends and our loved ones. I think what I might talk to her about is that even though staying socially distant and wearing a mask, those are some things that we can do to stay safer. But the safest option is to really limit our interaction with people outside the house.
So to just try to stay in your house for as long as we can during this pandemic.
Right, exactly. So in that way, you're keeping, you're doing your job as a parent to not only keep your daughter safe, but keeping her friends safe
Right.
and her friends' family safe, as well as the rest of the community.
Right. And Dr. Bunio, you could speak to this, as we've seen a lot of the asymptomatic carriers of it were some of the younger folks. And so we wouldn't really know that this community spread that's happening could be happening when we're letting children go to other children's homes or to visit. Is that right?
Yeah. So we talked about this many times about how you can be carrying the virus and spreading it and not even know it.
Right.
The people that are asymptomatic, children tend to have fewer symptoms. So a lot of the concern is that they're going to go and spread the virus in that community,
Right.
or when they're visiting their grandparents or somebody else whose immune system is maybe not as hardy.
Right.
Yeah.
And Kayla, there are a lot of homes here. Mine in particular, we have children that we share with other parents,
Mhm.
and so there's 2 homes that they're traveling between, and so that's even more concerning, and we have to be even more, sturdy with our rules and kind of how we're doing things and make sure we're keeping each other's families safe too.
Right.
Do you see a lot of that in the community as well?
It's tough. I think it's tough, especially for our older teens.
Yeah.
They're used to having some level of freedom and some level of independent responsibility.
Right. It's a rough age to be like holed up at home.
Exactly. Yeah. So it is really tough for them. So making sure parents are in agreement about what the rules are at
Right.
both households is really helpful, and really just acknowledging that this is a really hard time for them.
Right.
And it's okay that they're feeling sad or even angry and frustrated about what's going on.
Yeah.
And giving them some space to communicate that, whether with their parents or with their friends, maybe over
Right.
FaceTime or something.
And I think that's something we haven't really discussed enough, and I'm glad you're here to talk about some of that, Kayla. Are the emotions that are coming out of this as well? Because there are a lot of spin-off side effects of this pandemic where we're being holed up together. And when we talk about the frustration that our kids are having at times like this, we got to, as parents, also be patient to that and understanding, and try to have those open conversations and realize that we can't just lay the hammer down all the time and get angry and upset with each other. There's a lot of things that can spin out of control with that as well.
Yes, absolutely.
I don't know if you know this or not, Kayla, but I stayed at a Holiday Inn Express last night, and I've been on enough talk shows with Dr. Bunio that I think I know it all. I assure you I don't, and I'm just spouting stuff out.
He does this. Yeah.
I do. I run away with it sometimes.
And just to play off of that a little bit, I think it's important to know where your teenagers are. I mean, it's better to know than them do this in secret, because this is all about us contact tracing and controlling this pandemic. So just be, like you said, Chris, try to be open and honest with your kids, and if they are going to go out and hang with that friend that they absolutely can't be away from, it's better to know than they go and do that in secret. And well, then that becomes, kind of what we've called before, like a quarantine bubble, or, if one person in that family is positive, you want to know that, because your child may bring it home to you.
Correct.
But you want to be able to tell that other family if you get a positive in your household. So,
Right.
it's going to happen. They're teenagers. I was one.
That's true.
Once.
That's true.
Long time ago.
Did you guys write on paper then? Was it stone?
No,
work?
we
etched your paper, love letters in stone.
We did. Yeah, that's why I still have them.
I saw some of your early artwork in a cave this weekend.
Yeah.
Dr. G, what signs or symptoms should I look at if I'm worried that my child has COVID-19?
So the signs and symptoms of COVID-19 are going to be the signs and symptoms that you will see with a cold or with the flu. So fever, runny nose, cough, congestion, can be diarrhea, could be vomiting.
Yeah.
All of those are signs and symptoms of COVID also.
So if your kid's kind of out of place physically, it's something to be aware of and take note of all those symptoms and keep track.
And just keep in mind that a typical, just ordinary cold is probably going to be pretty much a runny nose, a cough, maybe a fever, and it'll probably go away within 3 to 5 days. But again, remember, a person can be totally asymptomatic with COVID.
That's true.
And kids are a little bit different because they don't get as sick.
Right.
And so, just keep in mind that if your child is sicker than usual, or if your kid's not a complainer, and they're usually not complaining of being sick, call your primary care provider.
Okay.
But one of the things that I've stressed, and Dr. Bunio knows this when this first came out, one of the things I said is, well, God, I've been dealing with COVID for the last 30 years because these are the symptoms kids have.
Mm-hmm.
But we got to remember that we still have strep throat, which gives you a sore throat, can give you a rash. Kids still get ear infections. And so you still want to call your primary care provider because those things need to be treated.
Right. Okay, good news. How do I help my kids cope with stress? What signs do I look for? So stress, again, we go back to that. Mm-hmm. How do we keep our kids calm during this time?
Yeah, absolutely. So with signs of stress for kids, sometimes that can look a little different than adults.
Okay.
They might have some more physical symptoms. They might complain of headaches, stomach aches, even like chest pain, or just unexplained aches or pains. They might be more clingy. They might be more irritable. They might have more angry outbursts. And then, of course, they can, be sad or worried or spending some time in their room alone more so than usual.
So we're still, as working adults, we're still in a busy mode. I know I get up in the morning and shower and come to work. And in the evening, I'm still I'm doing homework. I'm doing other things. How important is it that a parent take that time to just sit down with their child, just be like, hey, how are you doing today? How are you feeling? Let's talk. Do you have any questions? Can we talk about this?
Absolutely. Just taking some time to check in with your kids, especially if you're noticing some of those signs. And I really like what Dr. G had to say earlier about finding a good time to do that.
Right.
So making sure that it's a quiet time, it's a calm time when you can really put 100% of your focus with you and your child. And it can simply just be, hey, I noticed you've been having a hard time sleeping lately. Do you want to talk about that? I wonder if you're, missing your friends or worried about getting sick.
Right.
And just giving them that space. And also knowing that sometimes kids might want to talk or draw about their feelings instead of talking.
That's a good point. Mm-hmm. That's a good point. Utilize some of the artistic or creative outlets too. Pen and paper, crayons, letting them kind of get it out that way. Absolutely. Good point. We're social creatures, and especially in a community like this, it does affect us to not be able to have those boundaries, to not be able to be with our friends and family as often as we were. And so it's certainly something to pay attention to. Yeah. Dr. G, should kids be tested?
I think that's something that should be left up to the primary care provider. If you know for sure that a child has had a contact within a household, or as we talked about, adolescents, of course I do recommend that they be tested. We live in a community where we have a lot of our elders raising younger kids. And so I think it's important that we think about our elder community because they're more at risk.
Right.
And so, again, children can be asymptomatic carriers. And so if one person in that household is infected, I think they should be because they're coming in contact with those elders.
Gotcha. I agree. I'm scared about the coronavirus and want my family to be safe and healthy, but part 2. I'm pretty sure I'm annoying them more than anything, but it's so stressful to see them not doing everything that they should. What do I do? I guess it's a psychological question.
Yeah. So I was chatting with a friend, and even now when I watch TV or watch movies, I notice myself being like, "Oh, I can't believe they're so close together. They really need to separate." It's such a part of my mind now, so it's hard not to just be constantly watching out for that and having that anxiety. I think for kids, what might be helpful is I notice around our community we have the great signs with our 3 W's on them. Having that visual reminder is really helpful, and that's absolutely something that you can have in your household.
Right.
Maybe put a sign up by the door that says, don't forget your mask.
Don't forget your mask. Wash your hands.
Right, exactly.
Right.
And get your kids involved. Maybe they can help, draw or color them and put them up on the wall. And that way you might not feel as much pressure to be constantly on the lookout. They've got some other reminders there.
Good deal. I think everybody should print out the Dr. Bunio music signs that we've put all throughout town. Have you picked out a favorite of those yet?
I like the Sting.
That's right.
Yeah.
I like that. All right. So can the virus affect any other part of your body besides your lungs?
It can. As we have started with coronavirus, COVID-19, it has evolved. And so, initially it was the cough, the lungs. But what we found in children is that it can cause rashes, it can cause diarrhea, it can cause any of the symptoms that I mentioned previously. So that involves all organs. Pretty much of your body.
And I've seen where some folks, and I don't, again, I'm not a medical doctor, but where some folks are still having and experiencing symptoms after they've gone through this.
For kids, though, haven't seen a lot of that.
Okay.
But for adults, some have problems with return of taste.
Oh, wow.
I've heard of some memory problems, so
wow.
It can.
Okay. So my child thrives on routines. The last few months have been anything but routine, and now with school starting back virtually, it's only added the stress for my child and me both. I'm sorry. How do I help him adjust? So this is about routines. The going to school. This is going to be a whole new world for a lot of parents out here. How do we help the kids adjust to this?
Yeah, absolutely. I mean, we can't change what's going on in the outside world. Unfortunately, just not something in our control. And they're right. Routines help kids and adults feel safe and know what to expect. So what I usually recommend for parents is to kind of create your own routine at home. I know that it's a little easier when we don't have to go to school that, maybe they don't need to get dressed today, or, we can kind of just do things as we feel.
Right.
But it really is, kids respond really well when you sit down and set up a time of this is wake up, this is bedtime, this is when we'll eat breakfast, this is playtime, and this is school time. And again, maybe working with them to write that schedule down and post it up somewhere that they can see it so they know what to expect, you know what to expect, and you can all be on the same
That's a great
page.
idea. Create your own routine and schedule and keep it structured, because that structure will give you that. Shio, I apologize. We had some technical difficulties there, and we're back on now with Dr. Bunio and our guests, Dr. G and Kayla from the Cherokee Indian Hospital. And so we'll pick back up where we were there. I know, Doctor, it was probably the question I just asked you that was earth-shattering, and that turned the power completely off over here.
Yep.
But so what do I do after my kid returns home from school? Do they need to immediately change clothes, wash their masks? What do they need to do when they get back from school?
I would recommend that they take their clothes off and take a shower. I would recommend also that you have enough mask to use a clean mask every day.
That's
so
a good
if you have a
point.
cloth mask and they're only going to school 2 days a week, then have 2 masks and then you can wash them.
Yeah. At least the 2, and then have maybe
Yeah.
something in your car if you guys go out
Right.
to grab some groceries or something if they have to go with you. Of course, we still recommend trying to just limit the number of people traveling out anyway.
Right.
So will talking about COVID-19 increase my child's anxiety? This is a deep question here. I'm worried that they'll worry themselves crazy over every little cough or runny nose. Because let me tell y'all, I've woken up a number of nights now with a dry throat, and I'm thinking, worst case scenario, I'm a hypochondriac already. So I'm like, I got to go to Dr. Bunio right now. But is that something that we need to worry about with the kids?
I like what Dr. Gibbons had to say earlier. I think it's important to be honest with our kids.
Okay.
And also do it in an age-appropriate way. It's important for them to know what's going on and why they have to wear a mask so that they can follow guidelines. But they don't necessarily need to know every statistic and every update that's coming through. I think that's up for you as a parent to decide what's appropriate for their age. And really kind of like what we said earlier, just making sure that you're staying calm when you're speaking to them about this, making sure you're in the right frame of mind. Our kids are really looking to parents and adults to give them cues for how they should respond. If you're calm and let them know they're safe, then they're going to feel like it's okay to be calm and stay safe themselves.
Or flip side, have the kids keeping me calm because I had a big dinner and now I feel like I can't breathe, but it's just gas building inside.
They can talk you down.
Yeah, no, Dad, you're fine. It's just the 14 hamburgers you ate. How likely will my kid get coronavirus? What age group is more at risk for COVID-19 that you're kind of seeing?
So it's probably not likely that they will. The group that is at the highest risk are children or babies that are 12 months and younger.
Okay.
And so that's probably because of their immature development of their immune systems. And so moms who are out there who are breastfeeding, please continue to breastfeed.
Right.
Because that will help those children's or babies' immune systems. The other group that's probably more likely to be infected is our teenage group, and that goes back to them not wanting to social distance and wanting to be around their friends. So they're more at risk.
Right. Okay. My kid keeps asking me, when will this be over? What do I tell my child?
I'll get my calendar out. I'll see if I can find the date for you. Yeah, that's a hard question. Unfortunately, I don't think it's going to be a situation where we can say, oh, we're going to wake up tomorrow morning and everything's going to be back to normal. We've been through a lot of changes and transitions, and just as like now we're at our yellow phase, that's been a change and transition, and we're going to listen to experts and our guides, and we're going to just slowly transition back to normal activities.
Right.
And I think that's really important to focus on the fact that there may be some more changes to come. We may get back to a point where we're doing school face-to-face or in person. But it might look a little different. Maybe they have to
even
wear
in
masks.
that it'll be different.
Exactly. So, instead of helping them focus on this unknown time in the future when it's over, really just working to help be there for them during all these changes and transitions.
Deal. Dr. Bunio, are we seeing any more research or information out there about folks that have had the disease getting it again? Is that still a thing that's been studied?
They're looking at it. I don't think we really know.
Right.
We still think it's possible. There's some information to suggest that after you've had the disease for about 3 months after that, you're less likely to get it again. But again, this is such a new virus, and we're still learning. And there's to Kayla's point, we can't say when things are going to go back to normal. What is normal going to be?
Right.
There are countries that have lived through serious things like the bird flu, and where mask wearing is pretty much a way of life, or they have a high level of pollution or something like that. So we may see that we get what we've been referring to as the new normal. Yeah. Things will get better. Yeah. Just hang in there, but let's have some fun. Let's get you a real cool mask, and you can be the coolest kid at school, and let's turn this into something positive for them.
I really look forward to this fall and winter, when it gets cooler, to wearing my mask. I know the heat of the summer has been rough. It's been a tough one, but I went in a cave recently, and it was 55 degrees, and it felt great to have the mask on. It was kind of a little nose warmer for folks that stay cold-blooded out there. So then, whatever happened to this Kawasaki-like illness? Is that still something that we need to worry about?
So the Kawasaki type illness is something that we have seen in pediatrics for years, and it is related to children being infected with a virus. And so as it relates to COVID-19, it's termed multi-system inflammatory syndrome in childhood. And so what that means is that the virus causes different organs, blood vessels of the body to become inflamed.
Gotcha.
It can cause some severe problems where you get organs shut down. So it's still there. There's been some data that suggests that children that are more susceptible to that are children that have problems with their immune system
Gotcha.
to begin with. And so what I recommend to parents, we talked about the symptoms of COVID earlier,
Mm-hmm.
but if your child is really, really sick, you can't get them to wake up, they've been in bed, they're not eating, they're not drinking, then that makes me think more about this multi-system inflammatory disease. Or if their eyes are really red or their skin has a really bright red rash to it, that's outside of the normal, or I don't want to say normal symptoms of COVID, but the usual symptoms.
Gotcha.
And so it's still there, but we don't see it as frequently in kids.
Right. Okay. Good to know. So how do you maintain normalcy in your home when nothing is normal these days? There's murder hornets one day, explosions the next, virtual school, constant threat of getting sick. I'm exhausted myself. So how do you maintain normalcy when nothing is normal?
Right. It's been a really wild year.
Yeah.
That's what I like to say. It's
2020.
crazy out there. Yeah, and we can't control what's going on in the outside world. I think that's tough. But like I said earlier, really trying to have a routine in your household and maybe creating a new sense of normalcy, at least within your household or within your family. It's a great time to start some new traditions.
That's true.
Maybe you have a game night on Wednesdays or go for a walk after dinner. Some things that you can really look forward to,
point.
so you're spending some positive time together. I also want to say that a really important thing for you and your kids, especially your teens, to do is take a break from the news and social media.
That's a good point.
I
I think that's a valid point in all parts of your life in general,
Except this program.
except when you're watching us live. Make sure if you're on watching us is
Yeah.
what you're doing.
Right. Yeah. I mean, it's important to stay informed and know what's going on, but you do not need to be plugged in 24/7. It would exhaust anyone. So take a break, spend some time with your family,
Right.
do some art or listen to music. Just stay off social media for a little while. Yeah.
Earth gave us a bunch of beautiful natural things to look at and explore, and it's
Absolutely.
important to get to that. And maybe culturally, it may be a good thing for us to get back into.
Mm-hmm.
Learn the woods, learn the foods, and the animals that are out there for us to explore. So yeah, good point. When it's winter time and it's not 900 degrees outside, though. No, I'm kidding. Should I give my kid hydrochloroquine to protect them when they go back? Who's going to
No.
answer this? Is it Dr. G?
I think you
No.
could answer this one.
No,
No, we're done with that one.
No.
Do not give
No.
your children hydrochloroquine.
no.
The studies have said not to, right? I mean, that's kind of what
Just
we're...
trust us.
Just
No.
trust.
Don't do it.
We never said
Don't
no,
do it.
okay? Just don't do it. Say no to chloroquine right now. My daughter has asthma. Is she more at risk?
So what we know is that individuals that have chronic diseases such as asthma, diabetes, they are more at risk for COVID-19. But just because your daughter has asthma doesn't mean she's going to get COVID. So for anyone that has asthma, children, adults, you want your asthma well controlled.
Right.
So you want to see your PCP, make sure you have your inhalers, make sure you're taking your medicines. And because we know asthma is connected to allergies, take your allergy medicine.
yeah.
We live in the mountains. We have a lot of allergies.
All right, guys. I apologize again. We're back for the third time. We keep having power issues. We're going to check on that right after the show here. When we left off, Dr. G, you just mentioned, I guess, about asthma and making sure that everybody's taking care of their routine with that.
Right.
Is there anything to add to that? I don't know what
The
the
last
last
thing
part
I
of
want
that.
to add, as we go into flu season, it will be important for anyone that has a chronic illness to get their flu shot, and also for everyone in the community. Because the flu is a virus like COVID, the two will probably come together. And so if we can keep our flu numbers down, it's going to help the whole community out.
Absolutely. And will that be announced, Dr. Bunio, when we have the flu shots available?
Yep, absolutely. And actually, I was just talking to public health about scheduling some community, mass immunizations. We want to get as many people to get their flu shots this year as possible because, what you heard before is the symptoms of COVID and the symptoms of the flu and other viruses are very similar.
They overlap.
Right. So it's better just not to get the flu than to have to put yourself or your child through that and the worry that it might be COVID.
Correct.
Right?
Okay. So what do I do if I think my child has COVID-19 at this point?
Call your primary care provider.
Okay.
They can give you, or we can give you some direction on what we're going to do, what we need to do. So call your primary care provider.
Good. And finally, will my child be behind on their social development skills due to social distancing?
So one of the things that I want to remind parents, caretakers, is that when a child is born, you are their introduction to socialization. And so for children from birth to age 4, that's where they get most of that from, is from the family. And so do I think they're going to be behind? No. I do think that this is a great time for us to get back to being families.
Good.
Our daily lives, working, school, take us in so many directions, and they keep us, they really fragment the family. One of the things for my family, as my kids were growing up, we made a commitment that we had to reconnect once a day, and we did that at dinner time. So kind of just think of this as a time of reconnection. So I really don't think that the kids will be behind, but get creative. During the break we were talking about playing games. Get back to playing some board games. Get back to reading together. And if we do all those things, I don't think our kids are going to be behind.
Good.
And keep in mind, we still have our tablets, our phones, and so we can FaceTime.
Right.
We don't want to overdo it. It's kind of a catch-22 because we say try to limit their time on, electronic devices.
Right.
But it's a good way to stay in contact with family and friends.
Right. Using it in that means is a good way. Kayla, would you add anything to that?
I just want to remind families that kids are really resilient.
Right.
You're worried about education, worried about social skills and developmental skills, and they're going to bounce back okay.
Yeah.
And you've got a whole community here to support your family and support your kids. Lots of people that are working very hard to make sure everybody's on track.
Good. Well, thank you guys so much for coming on with us and making Dr. Bunio look great here. He needs all the support he can get. You guys do a wonderful job at the hospital, and all your staff and all your co-workers and everybody out there in the medical field right now that are helping to keep the community safe are doing a tremendous job. And the public, Dr. Bunio, are doing great. We're back down in yellow, so that's exciting. What are our update on some of our testing information? Are we getting results back any quicker now, or are there any alternative plans happening?
Yeah, right now we're getting our tests back on average 1.8 days. So 1 to 2 days. We're looking for all kinds of other options just in case it gets back to what it was.
Right.
That was unacceptable before. We were waiting a couple of weeks. So it's looking good right now, so knock on wood.
Let's do it.
Let's keep this community safe.
Good. Well, next time I see you, hopefully you're wearing the green mask and we're doing much, much better.
Yep. Don't make me pull out the orange one.
Yeah, let's burn that
Don't
thing.
do
Get
that.
thing out of here.
Yeah. And I don't want to touch that red one again.
Right. It doesn't match. Nothing matches with that.
No, it's not good with my complexion.
Right. It turns completely pink like I am.
Yeah.
Guys, thank you so much. People in the community, we thank you again. Sorry about all the technical difficulties. We'll try to edit this together into one piece so that you can watch it at home with your family. Dada Dog,